Hi, I'm Matt Wilson. I'm the Pain Control Product Manager for Septodont, and I'm here today to talk about the Dentapen, Computer-Controlled Local Anesthetic Delivery System, or CCLAD. Now, we all know that patients fear going to the dentist. And why? Because injections hurt. Why do injections hurt? Well, the typical dentist will give a full cartridge of anesthetic in just 20 seconds. Now, that may not seem like it's fast, but when you compare it to what should be done, it is. So anesthetic is acidic. It's like when you inject a full cartridge in 20 seconds, it's like pouring lemon on a cut. It hurts. By injecting slowly, it allows your body to adjust the pH of the anesthetic to be more neutral and take the sting away. Now, the Dentapen is very simple to assemble. Start with the finger grips. There are two styles, the syringe style and the pen style. Next, take the cartridge holder, insert it into the finger grip. Take your cartridge of anesthetic, and to attach, align the knob with the grooves. Push and turn. Your next step is to put a needle on. Any standard dental needle will work. I always use Septodont needles. They're the best. Now turn it on, and I'm ready to go. When I turn it on, the plunger advances a small amount. It's going to deliver a small amount of anesthetic to prime the needle. It's best to leave the cap on during that stage. Now the device has 3 speeds, and as we said before, slow is less pain. It starts, the middle speed is blue. That will deliver 1 ml of anesthetic in 1 minute. That's the speed that's recommended by most experts. Purple is the fastest speed. That will deliver 1 ml in 30 seconds, which is twice as slow as the standard dental injections that most dentists give. And again, slow is more comfortable. The last is the green or slowest speed that delivers 1 ml in 90 seconds. You'd use that for the most painful injections like palatals and PDLs. Next button is the mode button. There are 2 modes. The blue is the ramp-up mode. With the ramp-up mode, it's going to deliver very small amounts of anesthetic and ramp up to the speed you selected. And that's good to numb the tissue in advance of the needle as you insert it into the tissue. The next mode is the interligamentary mode. That's used for PDL injections. PDL injections require more force, and so what this device will do is to use that extra force, but still monitor the pressure that it's delivering and adjust as necessary. If there's too much pressure, the device will automatically stop. The next button is the retract button. When the cartridge is empty, you hit that button and it will retract and allow you to put a new cartridge in. Now the device is designed with patient safety in mind. So that means it has automatic aspiration. Every time I start the device, it'll aspirate. So to aspirate, I simply start by pressing on the finger grip. It's blinking blue, so I know it's delivering. When I stop, the plunger will pull back, creating negative pressure, thereby aspirating, and it will aspirate every single time I stop. Now this device is designed to be intuitive, it's designed to be ergonomic, and it's small and lightweight. It fits in the palm of your hand. If you compare it to a traditional syringe, you can see it's actually smaller and lighter. And unlike the competition, there are no cords, no console, there's no proprietary disposables. As I said before, it uses any standard dental needle. And you're not going to waste anesthetic in the tubing that's left over. And it is designed to work the way that a dentist works. They don't need to learn a new technique or a new process. They give an injection the same way they would with a standard syringe, but they get a better, improved result. The kit for the Dentapen includes 7 cartridge holders, 2 of the pen-style syringe holder finger grips, 5 of the syringe-style finger grips, 3 batteries. Each battery will last up to 200 injections, and 25 disposable sleeves that fit on the body to protect against infection or dirt. The body can be wiped with a standard alcohol wipe, and the cartridge holders and the finger grips can be autoclaved.